Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about turf toe. Now, turf toe is a very common foot injury that occurs when there is damage to the big toe joint. This is a very common sports injury and often seen in sports that require running on fields such as football and soccer. And actually the name turf toe comes from the fact that this injury is seen very commonly in athletes who actually have to practice or play on an artificial turf surface, which can create a lot of these types of injuries. Now, a turf toe injury is technically a sprain of the big toe joint. When one looks at the big toe, the joint back at the base of that toe is called the first metatarsophalangeal joint. And in this joint, there is motion up and down of the big toe. Now, for a wide variety of different causes, one can sprain the ligaments that surround this joint. There's a grouping of tissue that kind of holds the joint in place called the joint capsule, and technically all that is a ligament tissue which kind of binds these two bones together here and here. And during that injury process, the big toe either is excessively moved upward or it's excessively moved downward, although the upward motion is the more commonly considered part of the turf toe injury pattern. Now, what can happen during this excessive motion is that there can be tearing or damage to the capsule tissue that surrounds this joint. This tearing can be a very large tear or rip, or it can just be more of a spotty tear or more of a microscopic tear. Now, this damage can occur either from a very specific injury, such as coming down very hard on the foot and having a forceful bending of that toe, or it can be more gradual over time because of stressful repetitive actions which cause the ligaments surrounding this joint to become damaged and inflamed and injured. Treatment of turf toe injuries can be a little complicated just because of the very important nature of this joint during the motions of walking and running. The initial treatment is not unlike any other treatment for any type of sprain injury, such as ankle sprains. This basically includes resting the foot and decreasing activity, icing and elevating it because it's going to swell a little bit during the initial stages of the injury. However, a lot more usually needs to be done in order to treat this particular condition. That can include anti-inflammatory medications to help reduce the overall inflammation to the site, but often it needs to include some form of stabilization or increased protection of this joint to keep the tissue from moving excessively in order to allow it to heal. This can be very simple, such as a hard-soled shoe, or it can be more specific, like using a pneumatic walking boot in order to protect the motion of this joint to allow it to heal. Now, sometimes this injury doesn't heal very quickly, or sometimes it's not recognized immediately and it's therefore not treated right away, and it can become very chronic. The problem when this injury becomes chronic is that the tissue doesn't function correctly, and the end result sometimes can be stiffening or fibrosis of the joint, as well as in the long term possibly arthritic change to the joint itself. At least in the short term, this stiffening, this fibrosis can be significantly improved with the help of a physical therapist who can place the joint through a significant amount of range of motion exercises, as well as other types of therapeutic programs that help to stimulate blood flow and allow the joint tissue to heal. Now, in certain cases, the joint tissue doesn't heal through conservative measures, and what has to happen is surgery, essentially, to go in and repair the damaged ligament tissue that surrounds the joint, and to address any other injuries or joint problems or scar tissue that may be a result of sort of this condition being around for a long period of time, or the result of a more severe type of injury. Now, one other factor that needs to be considered with a turf toe injury is the possibility of damage to some of the structure that sits underneath the big toe joint. There are two little small bones called sesamoid bones that sit underneath the big toe joint in sort of these little grooves that are naturally there to help bear weight and to help with the walking cycle and with the way that the normal humans will move. Unfortunately, these little bones can be affected by a turf toe type of injury, and the bones themselves can either be fractured or bruised, or the ligaments that bind these two bones can also be damaged in much the same way that the ligament of the big toe joint can be damaged. And actually there can be a complete separation or complete dislocation or movement of these bones out of their normal track. Now, this is treated very similarly to a more severe turf toe injury, often with immobilization, but sometimes surgery is needed to repair any more significant damage to this tissue. While turf toe injuries and the associated sesamoid injuries are very much a nuisance problem for many athletes, they are repairable and they are fixable, but one needs to understand that this process does take a long time, at least several months for most people. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.